Hi, this is Nikki, and I'm the total joint nurse at the Orthopedic Surgery Center. Today, we're going to talk about how to get ready for surgery, what happens while you're here, and we're going to go over some basic discharge instructions for total shoulder replacement. In the center of the screen, you can see our Surgery Center website. Here, you can get some basic information like our hours, our address, etc. Off to the left, you have a couple of different ways to contact me directly, including my office line, patient cell phone that I carry with me, and my email address. You're more than welcome to save those in your phone and use those to contact me as needed before or after surgery, should you have any questions or concerns going forward. Let's start with some surgery prep instructions. These are some things that you've probably already done, but I just want to make sure that you're checking them off the list. You should have seen or at least scheduled your clearance appointment with your primary care physician. If you see a specialist like a cardiologist, you probably need clearance from them as well. But just know that you'll have to see that physician for an exam, do an EKG, and do some lab work. The signature from your primary care physician that says you're cleared for surgery is good for 30 days, so don't do this too far in advance, but don't wait until the last minute either. Second, if you use any tobacco, nicotine, or vaping products, please stop those as early as possible, as this helps reduce your risk of blood clot and surgery site infection post-op. If you haven't started this journey and you need some help with it, please let us know, as there are resources in the community that are happy to help you kick the nicotine habit. Also, starting today, if you haven't stopped your over-the-counter vitamins and herbal supplements, over-the-counter weight loss medications, or energy drinks like Monsters and Red Bull, please go ahead and stop today. I do have some examples of vitamins and herbal supplements on the screen, but this is not everything that's on the market. So a good rule of thumb is if it's an over-the-counter, probably best to go ahead and stop it now. I would like you to take the falls prevention checklist that maybe you got in our patient program handbook and go through the house, just to make sure there isn't anything in the way that's going to trip you up after surgery once you get home. If you need a patient handbook, please call me and I can stick one in the mail for you. We ask all of our total joint replacements to see a physical therapist one time before surgery. We want you to have some time with them to go over things like tips and tricks, do's and don'ts for your recovery. If possible, we'd also like you to learn how to put on your shoulder immobilizer or your sling safely and correctly. They'll also go over some exercises that you can do right after surgery to keep your good joints loose and mobile, but it's not a very aggressive program before you start formal outpatient PT. If you haven't got this physical therapy scheduled already, please let me know and we can work on that. Let's talk about some things you're going to need to purchase over the counter and have in the house before surgery. Off to the left, everyone needs to buy a bottle of chlorhexidine gluconate soap. It's also known as Hibiclens. This is a 4-ounce bottle and it's available at most major drugstores over the counter. Secondly, everyone is going to need to use lots of ice packs or gel packs or something after surgery to help keep the shoulder cold, and this helps with pain and with swelling. Dr. Mozik's patients need to purchase a bottle of 325 milligram aspirin tablets. This can be purchased at pretty much any drugstore, and we'll talk about how to use it after surgery. Dr. Murtag's patients need to buy that benzoyl peroxide all the way on the right. It's a little tube of an antibacterial gel, and I want you to use it before surgery. I have found it the easiest at walmart.com or Amazon, but sometimes you can find it over the counter as well. 1 week before surgery, we need you to stop all of the medications in red, so aspirin, anti-inflammatories, and anticoagulants. Please note it is perfectly safe to take Tylenol the 7 days before surgery, and you can still use heating pads and ice packs. If you take injectable weight loss medications like Ozempic or Mounjaro, please stop those a week before surgery as well. Typically, your surgeon's office will call you 1 to 2 business days before surgery and tell you what time to check in on the first floor surgery day. So depending on when you're watching this video, if you don't have your check-in time already, don't sweat. You'll get that phone call closer to surgery day. Preventing infection is toward the top of our to-do list in operating rooms around the country, but there are things that you can do before surgery to lower your infection risk. Between now and surgery, if you experience any of the signs or symptoms of illness or infection that are listed, like fever, nausea, vomiting, diarrhea, cough, cold, COVID, let us know so we can discuss if it's safe to proceed with surgery. We need you to be your healthiest self on surgery day. Do be very mindful of your skin between now and surgery, especially near the surgery site, as breaks in the skin can be doorways for infection. Please know if you have a break in the skin that looks infected on surgery day, or if there's broken skin near the surgery site, we may postpone your procedure for your safety. In order to help minimize this, we ask you not to shave your underarms on the surgery side for 3 days before surgery. Lastly, if you're not a good hand washer, now's a great time to become one because good hand hygiene is the #1 way to prevent the transmission of infection. 24 hours before surgery, please do not drink any alcohol as we're giving you anesthesia the next day. You are going to do shower #1 with the Hibiclens soap that you purchased the night before surgery. I do not want you to eat or drink anything at all after midnight unless you're told to do so. Please let the person know that's going to be your ride on surgery day that we do not have a cafe or cafeteria in the building. So I don't have anywhere to grab a sandwich or a hot plate, but we do have vending machines, a coffee pot in the waiting room. So we do have something for them while they're here. If you are a Dr. Hess or a Dr. Murtagh patient, you should have received a medication chart from me, and there are 2 medicines I need you to take the night before surgery that are on that chart. Please take a look at it and make sure you understand that information. To use this Hibiclens soap, I want you to take 2 showers with it. You'll do shower #1 the night before surgery, and you'll do shower #2 the morning of surgery. You are not going to use this soap on your hair, your face, or your genitals. You're going to focus everywhere in the blue box off to the right, and I want you to focus front and back from the neck down to the feet. I do want you to pay good close attention to the shoulder and armpit on the side where we're doing surgery. Once you get everywhere in that blue soap lathered up, I want you to let the soap sit on the skin for maybe 3 or so minutes and then rinse the soap away. Do not put any products on your skin after that. I do recommend that night you dry off with a fresh, clean towel, put on fresh, clean pajamas, and sleep on fresh, clean sheets. The morning of surgery, you just repeat all of these instructions. Jump in the shower, get the other half of that Hibiclens soap on a fresh washcloth, lather everywhere in the blue box front and back, good scrub on the shoulder and armpit that we're doing surgery on. Let the soap sit for about 3 minutes and then rinse it off. Do not put any products on your skin surgery morning, including deodorant. Dry off with a second fresh, clean towel, put on fresh, clean clothes, and come to the surgery center. Dr. Murtagh's patients need to do an additional step to help prevent infection, and I can also send you a chart with more specific instructions on this right here. 4 days before surgery, you're going to start applying that benzoyl peroxide cream that you purchased to your surgical shoulder after your regular daily shower. You don't need to use a whole lot. You just want to get a thin layer everywhere in that blue circle. You will still use the Hibiclens in the shower the night before surgery and the morning of surgery, like we just talked about. You'll apply that cream after each one of those special showers as well. And like I said, I have a chart I can share with you either through the mail or if we're meeting in class where I can write the dates on it so you don't miss any of these 2 particular steps. The morning of surgery, everyone will take shower #2 with the Hibiclens soap. The only medications you need to take before you leave the house are there in the middle in black. So we want you to take your heart, seizure, and certain blood pressure medications. Please note that all blood pressure medications are not the same. Do not take any blood pressure medications on surgery morning that are listed in red. If you're not sure what to take, give me a call. We can go over it together. As I mentioned before, do not put any lotions or powders or creams or deodorant or anything on your skin surgery day. I do want you to wear a very comfortable, loose, and easy outfit for surgery. I always recommend large button up shirts for total shoulder patients. All polish, acrylic, overlay, etc., needs to be removed from the fingertips or from the nails on the side that we're doing surgery. Remove all of your jewelry and leave all your valuables at home. If you use glasses or contact lenses, hearing aids, or have dentures or anything like that, please bring a case to put those things in because you have to remove everything before surgery, and we'll give it to your ride to hang on to while you're in surgery. Please note, your coach must drive you to the surgery center. They must stay at the surgery center the entire time that you are under our care. They may not leave to go run an errand, grab a bite to eat, and come back. All right, let's talk surgery day. You'll check in an hour and a half before your surgery time. And again, your surgeon's office will give you that time by phone a day or two before surgery. After check-in, a nurse will check your vital signs, height, weight, and go over your medical history, surgical history, allergies, and last time you took medications. In the pre-op area, we'll have you wiped down with some body wipes that have an antiseptic in them. We may also ask you to use some Q-tips with an antiseptic to clean your nose. This helps kill staph that's often found in people's nasal cavities. So these are some additional infection prevention measures we might take. Of course, we'll start an IV on you so we can hydrate you with IV fluids. Our anesthesiologist for the day will come in and do a pre-op nerve block where they inject anesthetic into your skin to help numb the arm after surgery. This will cause the arm to feel very heavy after surgery, but this is really helpful for pain control. Your surgeon will come in, answer any questions or concerns that you have, and mark your surgery site. As you roll into the OR, we will administer antibiotics in your IV that help protect you from infection. We will use general anesthesia on surgery days, so you will get medication in your IV that makes you very sleepy. Once you're sleeping really deeply, our anesthesiologist will put a tube in your airway to support your breathing while you're sleeping so deeply. When surgery is about done, the anesthesiologist will put medicine in your IV to slowly wake you up. When you're breathing well on your own, we'll take your tube out of your airway, and you'll finish waking up for about another hour or so with the nurses in the recovery room. A sore throat for a day or two is not unusual after this process. Surgery itself is going to be anywhere from 1 to 2 hours, and every person is different and depends on lots of variables, but please just go ahead and tell your ride that you'll be in the OR for approximately 2 hours. We will inject the skin and the incisional area with additional numbing medication to help control pain so that once you get home, you can start on a medication regimen and stay as comfortable as possible. Do remind your family and friend who's going to be with you that they must stay on the campus the entire time that you're here so that we can communicate about your progress with them easily. You will spend about 2 hours in the recovery room, but of course, every patient's different. You'll take about an hour to continue waking up from anesthesia. The nurse will take vital signs often when you first start waking up, and they can address pain if you're having any. When your vital signs look good, we'll move you to your post-op room where your family can come meet you. At that point, we'll spend some time getting you ready to go home, including getting you dressed, giving you some Sprite and crackers to make sure you don't get nauseated, and taking you on a walk to the bathroom. If you didn't get medication sent in by the surgeon before surgery, the nurses may give you the paper prescriptions at discharge so your family can have those filled once you get home. All right, let's talk discharge instructions. You'll get a copy of these based on your particular surgeon's preferences on surgery day, so you don't have to memorize all of these details. This is a good general guide. What do we want you to do immediately after surgery? I do want you to take short, frequent walks every hour during the daytime. Just get up and get that blood pumping and keep your good joints loose. The shoulder immobilizer that we put on you in the operating room comes with a little red ball that's kind of soft, and we want you to squeeze that ball multiple times throughout the day, approximately every hour during the daytime, to keep the muscles strong in your forearms, hand, and wrist. This also can help minimize swelling in your lower arm. I want you to use ice 4 or 5 times a day for 20-minute sessions. And so those are your basic to-dos. We want you to walk, we want you to squeeze, we want you to ice and elevate. Things we do not want you to do with the surgical arm until the doctor tells you to may include no reaching up, out, or back. So no using your surgical arm to brush teeth, comb hair, grab a cup out of the cabinet, etc. We don't want you to reach out to the side as if somebody was handing you something. And we don't want you to reach around your behind you, like to scratch your back or adjust clothing with that surgical arm. All of these motions could mess up some of the soft tissue work that the surgeons did in the OR, or this could cause the shoulder to dislocate. So please remember, no up, out, or back with the surgical arm. Additionally, we do not want you to lift, push, or pull with the surgical arm until the surgeon tells you to. This means if you go to get up out of a chair or out of bed, do not push off that surface with your surgical arm. Again, this helps protect the incision and keeps the shoulder from dislocating. Oops, sorry. So this is the infamous shoulder immobilizer that you may be in anywhere from 2 to 6 weeks. And your surgeon will tell you specifically when you can stop wearing this as you follow up in the clinic. You can also check your discharge instructions for how long your surgeon typically asks you to wear this shoulder immobilizer. You'll see it looks like a traditional arm sling, but there's a pillow that goes between your body and your arm, and this holds your arm at an angle that puts less stress on the shoulder. So you'll know you have the shoulder immobilizer on correctly when the elbow's at a 90-degree angle. As you can see in the picture, the patient's hand is right around the belly button or the pants waistline. It's not up near the chest or the collarbone. It's not near down near the hip or thigh. It's right there at the midline. Number 2, your hand should also be in the sling. We don't want your hand hanging out the end of the sling. We want it supported so that we don't have any weakness or issues in the hand or fingers. Number 3, the arm should always be just slightly in front of you. A good rule of thumb is you should always be able to see your elbow when you look down. If your elbow's back behind your body, it may be putting a lot of tension on the front of the shoulder where your incision is. If you have this shoulder immobilizer on correctly, your arm should be able to relax relatively comfortably into the immobilizer. You can see on the table at the bottom, you need to wear this immobilizer when you're up walking around, especially if you're out in large crowds because it helps people not bump into you. And you must wear this when you're sleeping for the recommended time from your surgeon. A few times that you can remove or loosen the immobilizer include doing a quick sponge bath, and you need to clean anywhere this immobilizer touches. You can take it off to get dressed and put it right back on. You can take it off or maybe just loosen it to do some simple range of motion exercises like bending and straightening the elbow, circling the wrist, etc. Again, I find button-down shirts are the easiest to put on and wear when you're using this immobilizer, when you have to also have this on correctly. A lot of people ask me how should I try to sleep after surgery? And so my number one response is probably in a recliner. People just really don't like to feel like the feeling of laying flat in their bed. They just feel like there's too much pressure on their shoulder and chest. So I like to point them to this picture. This patient has a pillow behind her head and neck. She has a second pillow vertical that supports from the shoulder all the way down past the elbow. And then she's got another one back there just in case you need some extra support to keep everything in place. And please note, she's got her shoulder immobilizer on while she's going to sleep. When it comes to preventing blood clots, we use 2 things for blood clot prevention: medication and movement. Every doctor is a little bit different, so your specific instructions on taking medications to prevent blood clots will be on your discharge papers you go home with. If you're not sure what you're supposed to be taking once you get home, give us a call and we can make sure that you start the right dosing on the night of surgery. Additionally, movement, which we've already talked about, helps promote circulation. So every hour when you move those ankles, take those short walks and squeeze that ball, prevents swelling, which can help promote circulation. Therapy after surgery will start anywhere from 1 to 2 weeks post-op. It depends on your surgeon's preference, but you definitely will have some sort of post-op physical therapy, and you'll need transportation to drive you back and forth while you're in that shoulder immobilizer. Make sure that the person that will drive you is set up ahead of time, and usually our patients go 2 times a week, anywhere from 3 to 6 months. As a nurse, I can tell you that you definitely need to take pain medication before your therapy sessions and ice that shoulder down after therapy sessions so you're not so miserable for hours after you get home from PT. We have a couple of different bandaging techniques, and your physician will choose the one that they like the best. Couple of our surgeons like this first option, including a traditional white gauze and white tape bandage. Sometimes it may be a clear sticker with gauze bandage that completely covers the incisional area. You may or may not remove this bandage at home, so please read your discharge instructions carefully so that you understand bandage care. You will have to sponge bathe until that bandage comes off. You can certainly get a soapy washcloth in the armpit, but nothing to the surgical area. To close the skin, we might apply a piece of tape that's super glued to the skin, as you see in this picture on the right side of the screen. Some surgeons may use steri strips on the incision that will loosen and fall off over time. Some surgeons like to use this vacuum bandage that's shown here. So this clear and white rectangle sticker will be placed over your incision in the operating room, and it's connected to a battery pack that also has a vacuum in it. It puts suction on that white gauze there in the center of the sticker, and this can help wick away drainage. It can help hold the skin together to promote faster healing. And typically 1 week after surgery, the batteries in the battery pack will die, and you will cut the cord. You just cut the tubing off, throw the tube and the battery pack away, and the rest of the clear and white sticker will be removed at your follow-up in clinic after surgery. Again, please see discharge instructions that are given to you on surgery day to know what you need to do as far as bandaging goes. Next, let's talk about the pain expectation and medication management at home. Once all the injections that we give you here, like the nerve block or the skin injections, wear off, you're going to feel moderate pain. You're going to be very stiff, very sore, very tight, and you may feel it up into the neck, down into the chest, etc. So you're going to need to do a lot of things to help keep that pain tolerable. You are going to start the medications that the doctors prescribe to you right away when you get home. Before you start hurting, we want you to start taking these medications, typically taking something every 4 to 6 hours just to keep it in your system. Again, you should use ice several times a day for about 20 minutes each time to help keep inflammation down. And you can put ice anywhere in that shoulder area, up into the neck, down onto the chest wall, over the bandage, as long as your ice pack's not leaking onto the bandage. It's not uncommon for patients to not really be hurting too bad and think they don't need any pain medication for the first day or so. But once everything wears off, you're kind of too late at that point, and it may take several hours to get you comfortable. So do not wait until the block wears off before you start medicating. You want to medicate ahead of time. If you're taking pain medication, like I'm asking you to take pain medication, I also want you to take something like Miralax twice a day until you start having pretty regular bowel movements. It does not take a lot of medication and anesthesia and immobility to constipate you after surgery, so be proactive here. Please note, Dr. Hess and Dr. Murtagh, patients, I referenced a medication chart earlier. On that chart is how to take pain medications after surgery as well. Please follow that to the T as close as you can, again, to keep you as comfortable as we can. I want to make clear to all patients, you should not expect to be pain-free for some time after surgery. I think pretty much everybody understands that this is a major surgery, but I just want to make sure we all have a realistic expectation. When should you call me or the Bone and Joint Clinic to report a problem? We absolutely need to hear from you if you've had a fall, even if you think you're okay. If you've got uncontrollable, severe, unrelenting pain. Again, you're going to have a moderate deep ache anytime we do bone surgery, but ice, rest, and pain medication should get it to the point where you can still sleep and eat and move around, etc. Any change in the color, temperature, or feeling of an extremity, especially of your hand, would need to be reported. So if something becomes ice cold or red hot, please let us know. Any kind of bleeding or drainage from the incision site is pretty unusual. These are generally very clean incisions. So if we're saturating bandages, we need to know about that pretty quickly. You will have some follow-up appointments, and every physician here is different, but most of the time you'll see us at 2 weeks for an incision check, around 6 weeks for an x-ray, and then anywhere from 3 to 6 months, we're checking in on your progress in PT. Maybe we're starting to ease up on the restrictions and let you do more and more with your surgical arm. All of our total joints come back for 1-year anniversary x-rays. If there's an issue that you and I are troubleshooting by phone and we can't resolve, we can always add appointments if need be, instead of you going to the emergency room or to urgent care if at all possible. Also, please keep track of your pain medications. If you're starting to run out of medications, you can certainly call the surgeon's office directly for refills, but if you're coming in for a follow-up appointment, we can go ahead and get those refilled at the same time. Please note that we cannot refill pain medication prescriptions on nights, weekends, and holidays. Some general activity restrictions are listed here. No driving until you're off of narcotic pain medication and you're out of the shoulder immobilizer. Again, every surgeon's time in the immobilizer is going to be different. So check those discharge instructions, and follow-up appointments can help keep you on the timeline. To avoid blood clots after surgery, you want to avoid long car trips or flying, at least until your first follow-up appointment. As long as your incision looks okay and your swelling is controlled, they may clear you to travel, but let us see you at least one time before you plan anything. To prevent infections after surgery, you want to avoid routine invasive procedures like dental work and colonoscopies. This just gives time to your immune system to finish dealing with your surgical recovery before handling something else. Some general return to work timeline. If you're going back to desk work and it's okay to wear your shoulder immobilizer while you're at work, usually you can go back in 2 to 3 weeks as long as your surgeon gives you the okay at your first follow-up appointment. If you do physically demanding work, it's going to be a few months before the surgeon will give you the all clear. Any papers that need to be filled out for leave need to be turned in to the front desk ASAP. It can take up to 2 weeks to get everything filled out appropriately. So please drop it off at the front desk and let them know what surgeon's office that needs to go to. That's it. You've made it. You should have a handbook from me if I'm sending you this video. It should either be in your hand or in the mail coming to you, and it's got everything printed out that I just talked about. Again, my contact's at the beginning of this video and in the handbook, and all of my contact information will be on your specific discharge instructions. So if you have a medical or clinical question, please let me know what I can do to help you. Thank you so much for your time, and I hope you have a great recovery.